So, if you're watching this, chances are you've been dealing with back pain that just won't go away. You've taken the Panadol, you've tried the heat pack, you've done the whole rest for a few days, and it'll be fine thing. And yeah, maybe it gets better for a week, maybe two, but then it comes right back. And now you're lying in bed at night, shifting positions every 20 minutes, and that little voice in your head is going, what if this is just my life now? Stay with me, because what I'm about to tell you about your lower back pain is going to change how you think about it entirely. I'm Raj from Kinesio Rehab. If you caught yesterday's video, you know my story. If you didn't, I was paralyzed at 15, physiotherapy gave me my life back, and now I've spent 13 years and over 5,000 patients learning everything there is to know about pain. And lower back pain, this is the condition I see more than anything else. It's not even close. In Malaysia, back pain is the number one reason people miss work. Let that sink in. Not the flu, not headaches. Back pain, but here's what I'm not going to do today. I'm not going to give you a list of stretches and send you on your way. But what I am going to do is explain what's actually happening inside your spine, why your current approach isn't working, and what you need to do differently. Sound fair? So here's what usually happens. You get back pain, you see a doctor, the doctor examines you for about 3 minutes, maybe 5 if you're lucky, and says, it's a muscle strain. Take these painkillers, rest for a week, you'll be fine. And look, I'm not blaming the doctor. They've got a waiting room full of patients and 7 minutes per consultation. They're working within the system, but muscle strain has become it's probably a virus of back pain. It's the default answer when nobody has time to dig deeper, right? Because here's the thing. Your lower back pain could be coming from at least 5 completely different sources, and each one needs a completely different treatment. Let me walk you through this. And I promise I'll keep it simple, no medical jargon, no anatomy textbook, cause number one, disc problems. You've probably heard of a slip disc or herniated disc. Between every bone in your spine, there's a soft cushion like a jam donut. The outer layer is tough, the inside is soft. When that outer layer weakens from years of sitting, from a sudden lift, from repeated bending, the soft inside can push out and press on a nerve. That's when you get pain shooting down your leg. That's sciatica. And no amount of Panadol is going to push that disc material back in. Cause number two, facet joint irritation. On the back of every spinal bone, there are small joints called facet joints. They guide how your spine moves. When these joints get inflamed, usually from prolonged standing, arching your back, or sleeping on your stomach, you get a deep aching pain right in the center of your lower back. It usually feels worse when you lean backwards. Completely different mechanism from a disc problem, right? So the treatment has to be completely different. Cause number three, sacroiliac joint dysfunction. This one is sneaky. The sacroiliac joints are right where your spine meets your pelvis. If you put your thumbs on those two bony bumps at the top of your buttocks, you're touching them. These joints can become stiff or unstable, especially after pregnancy, after a fall, or from years of asymmetric loading, like always carrying your bag on the same shoulder. The pain often shows up on one side only, and it can mimic sciatica. Cause number four, muscular weakness and imbalance. Now, this is the one that's actually closest to muscle strain, but it's not a strain, it's a pattern. When your core muscles, the deep stabilizers around your spine, are weak, your spine doesn't have the support structure it needs. So other muscles start compensating. They overwork, they spasm, and then you get pain. But the pain isn't the problem. The weakness is the problem. The pain is just the alarm bell. Cause number five, referred pain. Sometimes your back pain isn't even coming from your back. Kidney issues, abdominal problems, even hip conditions can refer pain to your lower back. This is why a proper assessment matters, because if you're treating your back and the problem is actually your hip, you could do physiotherapy for months and get nowhere. Now here's where it gets really important. Each of those five causes responds to different treatments. A disc problem often needs extension-based movement, bending backward, not forward. But a facet joint problem gets worse with extension. See the issue? If your doctor says muscle strain and you treat it like a muscle strain, but the actual problem is a disc herniation, you could be making it worse. You could be doing stretches that are pushing that disc further out. This is why I spend 45 minutes to an hour on a first assessment, not 3 minutes. 45, because I need to figure out which of these 5 problems you actually have. And sometimes it's a combination of 2 or 3. Your back is complicated. It deserves more than a 3-minute diagnosis. Think of it like this. Imagine your car is making a grinding noise. You take it to a mechanic. The mechanic listens for 3 seconds and says, it's probably just the brakes. Here's some lubricant. Would you trust that? Or would you want the mechanic to actually open the bonnet, run diagnostics, and find the real problem? Your spine deserves at least the same attention you'd give your MyV, right? So here's the part that might be uncomfortable to hear. Your back pain isn't a painkiller deficiency. I know that sounds obvious when I say it out loud, but think about how most people actually treat their back pain. Pain appears, take a pill. Pain goes away, pill wears off, pain comes back, take another pill. That's not treatment. That's muting the fire alarm while the building is still burning. The painkiller doesn't know why your back hurts. It doesn't care whether it's a disc, a facet joint, a weak core, or your SI joint. It just switches off the pain signal. And when it wears off, surprise, the signal comes right back. Because nothing has changed. And look, I'm not anti-medication. Sometimes you need pain relief to function, to sleep, to get through the day. That's valid. But if painkillers are your only strategy, if you've been taking them for weeks or months, you're not managing your pain. You're avoiding the conversation your body is desperately trying to have with you. Your pain is information. It's not the enemy. It's your body saying, hey Jen, something is wrong down here and I need you to pay attention. Ignoring that message doesn't make it go away, it makes it louder. So let me ask you honestly, how many months or years have you been managing your back pain instead of actually addressing it? How many activities have you quietly stopped doing? The hiking you used to love, the badminton games on the weekend, playing on the floor with your kids or grandkids? And here's the deeper question, what's actually stopping you from getting proper help? Is it time? Is it money? Is it the belief that it's not that bad? Because in my experience, most people don't come to see me when the pain starts. They come to see me when the pain has been there for months, sometimes years, and they finally reach the point where they can't ignore it anymore. And by that time, what could have been a 3-session problem has become a 12-session problem. Every week you wait is a week the problem gets harder to fix. That's not a scare tactic, that's just how the body works. Alright, so here's what you actually do. Very simple. Step 1. Stop guessing. If your back pain has been around for more than 2 weeks, or if it keeps coming back, you need a proper assessment. Not Google, not your uncle's advice, not a TikTok video. A real, hands-on 45-minute assessment where someone figures out which of those 5 causes is your cause. Because the treatment for a disc problem and a facet joint problem are literally opposite approaches. You can WhatsApp us at 012-934-9471 or visit kinesiorehab.com. And book a back pain assessment. I'll personally find the root cause. Step 2. Stop treating the alarm. If you're currently taking painkillers regularly for back pain, that's okay. Keep taking them if you need them. But start the process of finding out what's causing the pain. Use the painkillers to get you through while you fix the actual problem. Don't let the painkillers be the solution. Step 3. Reconsider rest. Here's the one that surprises most people. For most types of back pain, prolonged rest makes you worse, not better. Your spine needs movement. Gentle, appropriate, guided movement, but movement. Bed rest for more than 2 days is now discouraged by every major clinical guideline in the world. Motion is lotion for your spine. Now, I'm not saying go run a marathon. I'm saying don't be afraid to move. And if you don't know what movements are safe for your specific problem, that's exactly what a physiotherapy assessment will tell you. You deserve to bend down and tie your shoes without wincing. You deserve to sleep through the night without waking up to shift positions. You deserve to play with your kids on the floor and get back up without groaning. 90% of lower back pain resolves with proper treatment. 90%, that's not my number, That's the global research. The vast majority of people with back pain get better with the right approach. But the right approach isn't random stretches from YouTube. It's not painkillers and hope. It's someone who spends 45 minutes understanding your spine, your movement patterns, your life, and building a plan specifically for you. That's what we do. And it works. 5,000 patients can vouch for that. So remember, your back pain has a specific cause. Find the cause, fix the cause, and the pain takes care of itself. If you want to learn more, head to kinesiorehab.com.my. I've written a comprehensive guide on our lower back pain page. And if you're ready to stop guessing, WhatsApp us and let's figure this out together. Tomorrow, I'm going to bust 7 physiotherapy myths that are probably keeping you in pain right now. Some of these are going to genuinely surprise you. You've got this. Take care of yourselves. I'll see you tomorrow.